Hello, everybody. It's my pleasure to give this presentation here. My topic is the perspective of perinatal women on anti-COVID-19 pandemic in Macau society, a qualitative study. Here's the outline of my presentation. First, the introduction. COVID-19 epidemic has been significantly changing human beings worldwide. Any outbreak of epidemic could cause significant public, pandemic, and psychological impact on citizens. Macau Special Administrative Region is located in the Greater Bay Area and is reputed as the most densely populated area in the world. In addition, Macau is a world tourism hub and gaming industry city. Crowded area has a high potential risk of transmission of infectious diseases. Taking the lessons from SARS in 2003, Macau government responded to COVID-19 pandemic very quickly and has implemented serious stringent measures. The measures include lockdown city, stay at home, mandatory wearing of masks, and so on. On January 22, 2020, the first imported confirmed case occurred in Macau. As of October 22, 2021, Macau has accumulated 77 cases. 66 patients have recovered and been discharged from hospital, and no one has died. There was no medical staff infected, and there was no local community transmission. So in generally, for a city with a population density of more than 20,000 people per square meter, and a total population of nearly 700,000 people, the control of pandemic is satisfactory. The measures are indeed effective in curbing the virus spread, but measures inevitably carry out negative impacts. Pregnant women are particularly sensitive to all related to the pandemics. So my study aims to understand and reflect the measures of anti-COVID-19 from the perspective of perinatal women. Part 2, methodology. This study utilized a qualitative interview to collect data. Here's the inclusion criteria and exclusion criteria of the participants. And the sample size was determined by data saturation. Finally, 18 participants were individually interviewed. And with literature review and experts consultation, 6 semi-structured interview questions were formulated. And before the formal interview, a pilot interview was conducted. Here are the final questions. And to avoid personal contact during pandemic, the one-to-one interview was conducted by telephone. And data analysis was performed simultaneously with data collection. And the ethics community of MPI approved the study before data collection. Part 3 findings. There are totally 4 themes. First one, strict and successful anti-epidemic measures implemented. The multiple measures were implemented strictly, but the participants generally acknowledged all measures were necessary and effective and show cooperative. One of the participants said, "The mirrors indeed carry out a lot of inconveniences, but I feel it's necessary. Otherwise, our city could be collapsed like other places." Theme 2, humans' attention to people's daily life. Most of the participants agreed that the Macau government is very human in fighting the COVID-19 epidemic. The participants said, "Considering the risk of my baby and myself, I applied an unpaid leave since the outbreak of COVID-19. However, our government is really very nice, waiving our water and electricity fee and offering electronic consumer cards with 10,000 Macau petka for each resident. The government is very thoughtful in the pandemic. They offer free disinfectants, even issues at everywhere, such as all entrance of buildings, elevators, supermarkets, etc." Theme 3, timely informed provided, but being overwhelmed. It's good to offer the update information to society. However, some participants expressed they were overwhelmed by the diverse information. They said local TV channels 24 hours broadcast the local, nearby, or global new cases, the death rate. At the beginning, I'm eager to know all related information, but I feel quite exhausted and confused when too much information, particularly some unpleasant news, make me uncomfortable. Theme 4, difficulties and special expectations relate to anti-epidemic. About half of the participants expressed their pregnancy follow-up visits were interrupted and face-to-face health education was cancelled. They said, "I hope the hospital could set the special ward for perinatal women and their families during this special period and reduce some tedious and complicated procedures. It could be much better if hospital can offer more health education program and guidance to us." Part 4, discussions. Like many countries and regions, the Macau government had adopted various restrictive measures to prevent the spread of the epidemic. These measures actually confine the freedom of residents and significantly affect their daily life. However, our findings demonstrate that the pregnant women generally acknowledged what the government and health professionals done. A public online survey conducted in Macau showed 19% positive responses. However, some participants expressed their difficulties during the pandemic. So the online medical service might be a good alternative, like a medical center in New York applied telemedicine to offer prenatal care during the epidemic outbreak. So that might be a good example for Macau health professionals to learn and to work out. And Macau also has imposed restrictions on hospital visits, so mothers have to face the process of childbirth alone. Therefore, further study is necessary to track the postpartum experience of women and their special needs during the pandemic. Advanced information technology of people multiple means such as Facebook, Weibo, WeChat, but simultaneously overwhelmed them. Therefore, it's necessary to educate residents how to screen the authenticity and reliability of the information. Conclusions. The COVID-19 epidemic and the anti-measures impact human beings and affect all aspects of people's lives. particularly those vulnerable groups such as pregnant women. The present study demonstrated that the majority of participants generally perceived all implemented measures were necessary and effective, but there are some aspects need to be improved. And there are some limitations in this study because the interview was done through telephone, so the interviewers could not observe and record the facial expressions of the interviewees, and there might inevitably have some recalling bias. That's all. Thank you very much for your attention.